Good day everyone, this is Heber Ilapiceros, a student nurse from Davao Doctors College, and today I'm going to perform the Leopold's maneuver. Leopold's maneuver are four systematic steps in palpating the uterus through the abdomen. This is to determine the fetal presentation and the fetal position. This is usually performed at the 24 weeks age of gestation when the fetal abdomen can already be palpated. So upon doing the procedure is we need to wash our hands because washing our hands is the universal way of preventing the spread of microorganisms. So after washing our hands, now is we need to introduce ourselves and we need to verify our client's identity using the agency protocol, and we need to explain of what we are going to do and why is it necessary. So by doing this is we are building the interesting relationships between the healthcare professionals to the client and of course to build rapport. Okay, ma'am. Good morning, ma'am. Ako nga pala si Heber Ilapiceros. Ma'am, I'm your student nurse for today, ma'am. So, unsa gani pangalan nato, ma'am? Okay, Ma'am Juan Galvez. So, unsa na gusto na ko itawag sa imo, ma'am? Okay. Okay, sige, Ma'am Joanne. So, Ma'am Joanne or Ma'am Jo, karon is mag-perform ako in Leopold's maneuver. So, Leopold's maneuver, ma'am, is I'm going to determine sa kung saan position or saan nakalay yung fetus po natin sa inside our uterus po, ma'am. So, madidetermine natin kung saan good siya nga side, kung tsaka yung fetal heart tone po natin, ma'am. Okay? So, nakakatawang ubang pangutana, ma'am? Okay. And of course, in doing the procedure is we need to provide privacy. We need to consider our clients' feelings and dignity. Okay. Ma'am, bago tayo mag-start, ma'am, is it okay kung i-close ko muna yung window or yung door natin, ma'am? Para mas comfortable pa tayo. Okay. Thank you, ma'am. Now is we need to let the patient empty his bladder before the procedure. So this is actually to provide comfort and because distended bladder can deviate the uterus position. Okay, ma'am. So nakapag-void na po, ma'am, or basing gusto niyo po pumunta sa CR, mag-ihi, ma'am. So para yung diretso yung procedure po natin at tsaka comfortable ka po. Okay, tapos na. In doing the Leopold's maneuver is we need to position our clients or our patient in a supine. Then we need to put a pillow under our patient's head. Then of course we need to her knees slightly flexed. Okay. Then upon doing this is we need to put or place a rolled towel under the woman's right hip. So here, going to put here. So, like that. Then, of course, we need to, if you are right-handed, then we need to stand at the woman's right. Then we need to face our patient like this. So, this actually, so that you can do maneuvers according to what you are comfortable with. Before we will do the first maneuver is we need to drape our patient because we need to expose only the abdomen of our patient. So, this. So, this way. This. So in doing that, so next is we need to do the first maneuver. The first maneuver is the fundal grip. So we need to face the patient and palpate the uterine fundus. And of course, to determine what part of the fetus lies in the upper part of the uterus. So, okay ma'am, ako ma'am ang atong abdomen ko, ang atong chest. So, okay lang tayo, ganun ko ma'am. Okay, ma'am. Okay ma'am, mag-perform ako ma'am ng fundal grip ko. So the fundal grip actually helps to determine the fetal part presents to the fundus of the mother. Like this. So the second maneuver is the umbilical grip. So in doing the umbilical grip is we need to palpate in a downward direction and the size of the abdomen, applying gently but deep pressure, okay, to determine the position of the fetal extremities in the fetal back and of course the anterior shoulder. So the umbilical grip as the second maneuver helps determining the fetal parts like the back and the shoulders of the fetus. The third maneuver is the pollex grip. So in doing the pollex grip is we need to places our hand over the symphysis pubis, then grabs the lower uterine segment, and of course we need to between the thumb and the fingers to feel the presenting part. So here, okay ma'am, dili na ako ma'am, sa symphysis pubis po natin. So the pollex grip as the third maneuver where the presenting part of the fetus is being determined, whether it is engaged or floating. The fourth maneuver is the pelvic grip. In doing the pelvic grip is we need to turn and we need to face to the women's or patient's feet like this. This is to confirm the findings of the third maneuver and of course to determine the flexion of the vertex. So the pelvic grip as the fourth maneuver is determining the result of the third maneuver and to determine the flexion of the vertex. So as I've said earlier, so we need to locate again for the back of the fetus and places the stethoscope. So now we are going to use the stethoscope for the fetal heart tone or the FHT. But in order for us to clearly hear the fetal heart tone of the fetus is we need to use the smaller side of the the bell. So we need to use the bell for at least 1 full minute. So as I am doing this, we need to locate or the location and of course the rate and the character of the fetal heart tone of the fetus. This is to make sure that the fetal tones has the normal beating pattern. So that's the 4 systematic steps in palpating the uterus. Okay, Ma'am Jo, tapos na ta ma'am sa pag-perform ng Leopold's maneuver, ma'am. So, can I, i-drape na natin yung ano po natin para ma-cover natin yung abdomen natin. And of course, mamaya ay mag-relax po tayo na comfortable position po. Okay? Thank you, ma'am. So after performing the four systematic steps or the Leopold's maneuver, and of course we need to place our patient in a comfortable position in order for her to relax her abdominal muscles. And now is I'm going to document the observation that I noticed earlier that I was performing the procedure. So, ma'am, kumusta po tayo, ma'am? Okay. Okay, Ma'am Jo. So, yung observation ko po kanina, ma'am, as I did the Leopold's maneuver, ma'am, yung 4 steps po natin, ma'am. Yung fetal lie po niya, ma'am, is longitudinal, ma'am, which is usually the normal positions ng baby, ma'am. Then, yung presentation niya, ma'am, is vertex siya, ma'am. So, ibig sabihin, ma'am, yung head ng baby is directly to the pelvis. Okay? Then, yung attitude po niya, ma'am, is, yung attitude po niya, ma'am, is naka-flex po siya. So, well-flex po si baby, ma'am. Then, yung fetal heart tone po niya, ma'am, is very good si baby, ma'am. Kasi yung fetal heart tone is 143, which is normal because normal kasi is nag-range from 120 to 160 beats per minute. So, that's it, ma'am. So, do you have other clarification, ma'am? Nakapay kadugang, ma'am? Okay, ma'am. Napay pangutana, ma'am. Okay. Thank you, ma'am, sa cooperation, ma'am. Okay, so of course, after performing the Leopold's maneuver, don't forget to wash our hands. And that's how I perform the Leopold's maneuver.